I came to my position because I was getting calls from school nurses, in particular in my own school district because I had done some work in the schools, but actually from all over the state. The state oral health program had been defunded in 1993. And as a consequence, the school nurses were seeing kids with a lot of disease, who were spending time in the nurse's office with pain and infection, who had to go home and miss days from school. And so the school nurses who knew me from my work in the schools called and said, how can we restart this program that was defunded? There was some money available through the community grant project, and with help of a couple of school nurses, we wrote some grants that were funded and started the school-based dental programs up again. And they have just grown because of the demand from the local communities who wanted to have similar programs in their communities, who wanted to expand the programs that they had. So now we have, from a starting place of 1 or 2 programs, there are now 20 programs in 183 schools around the state. The growth of the programs has come because of local community commitment. The strength of the program is that these entities grow as grassroots responses to a local needs assessment or a hospital or health center that recognizes that the kids in the community have unmet dental needs. And the schools seem to be a good place to start because you have a captive audience of students. And if we can put a dental hygienist in there to screen the students, to provide them with some classroom education, to teach them how to brush their teeth, to do some cleanings and fluoride application, and then also refer them to dentists for reparative work when they need it. We have done several surveys to assess the oral health of children statewide, and consistently the North Country comes up as the region in the state where children have the greatest unmet dental needs. And because there are also fewer dentists up there, it's even harder for the children that we identify with needs to get into treatment. The H&H Foundation stepped in to fill the gap where we needed funds to pay for the reparative work that the children identified through the school-based program needed to have. And the dentists were happy to see them and have accepted them into their practices in many cases. And so it's been a wonderful fit, an extension of a preventive program to take care of the children who had needs to have their teeth filled and reparative needs that we just couldn't do for them.
The H&H Foundation, like most foundations, loves to leverage funding. So what that means is we provide some funding, and through our funding, an entity might be able to get more funding. So we did this recently with the New Hampshire Department of Health and Human Services, in that we provided them with a small amount of funding to hire a grant writer. The purpose of that funding was to build capacity within the state oral health program. It's a very lean program. They do a phenomenal job of providing support throughout the state for oral health care, but they really need more capacity. And we were really pleased to be able to collaborate with the department and the oral health program in providing this limited funding to them to hire a grant writer. And in fact, it resulted in a grant to the department to build capacity within the oral health program, and I couldn't be more excited about that.
The CDC grant that we were recently awarded has come to us thanks in great part to the efforts of the H&H Foundation to support the oral health program at the Division of Public Health Services. The oral health program there is a one-person program with a staff of 1. That would be me. I have been the only person there since 1998, and with the help of a lot of support and wonderful people at the department, we've been able to grow the program. But there's just so much that one person can do.
I'm passionate about children being able to access preventive oral health services as early as possible. And that passion comes from my experience as a foster parent and seeing firsthand what children have to struggle with when they don't receive those preventive services. I've had foster children who were in great need of oral health care. They would be the ones that would benefit from our restorative care. I've had foster children who couldn't eat, who weren't happy kids because they were in constant pain, who needed restorative care. So it was that's where my passion comes from, is actually having children in my home who had need for services.
No child ever needs to have a decayed tooth, and some of them suffer terribly from dental disease, and it's unnecessary. And it's the fault of all of us who don't provide the education, the preventive care, and the access to treatment that they need, because we could save time and energy and pain if we could get to them early, teach their parents how to care for them and care for their children's teeth, and make it just part of their daily lives. It's doable.